So I actually first got into the whole field of medicine because I was helping my mom going through her cancer therapy. And my initial thing was that I wanted to be an oncologist because that's the world that I knew. That was kind of what was cool to me. And then when I lost my mom at the age of 19 after 5 years of battle with cancer, that's when I decided I could not be an oncologist. And I tell you right now, retrospectively, if I did go through the oncology path, I don't think I would have been in oncology right now. So that was the moment that I had to sit and think about, what do I really want to do? I've dedicated, quote unquote, my life up until that point in order to go to med school and do this. I still wanted to be in some sort of a medicine, but I needed to be in a medicine where I can develop relationship and not have people die on me all the time. So that's when my advisor told me that I could consider three different areas. It was eyes, teeth, and feet. And I thought, I don't know about the feet. I still don't want to touch feet. And eyes, there's something weird about, like, I don't want to get into this whole eye thing, and they're way too close. Although I feel like dentistry were right there with the patients too. I didn't really know anything about dentistry at the time. I went to this 1 week course at University of Maryland. They kind of do overall kind of introduction to dentistry part of it. I don't think it's there anymore, but I went and I spent a week and I loved it. And that's when I changed from pre-med to pre-dental. And honestly, I don't know if I look back. So whenever I talk to my young patients right now, who's kind of in that 18, 19, 20, going to school, college, not sure what they want to do, I always kind of say, don't be too hasteful. Like, take your time, figure out what you really want, because life is a marathon. It's not a sprint. So you just need to figure out where you want to go, how you want to be it, because what you think that you want to do may not be where it is. So I'm kind of more, as I'm getting older, and like I have, two children in college and one graduated from college too. I feel like they need to take their time. It's like so many people think like, this is what I want to do. They get into school and they think that's where I want to be, but you don't know that. You don't know until you get into it if that's what you really want and what you really don't want. And I kind of see that in my own field too. I talked to a lot of dentists. I talked to a lot of young dentists coming out of school. Some are just, this is what I wanted to do. This is what I'm excited about. And some kind of go, I don't know if that's what I want to do. I mean, you only live once. You got to be passionate about what you do. So I think but even if it's not, I think you can always find that passion and then reignite that interest back in, especially if you spend this much time into it. So it's interesting now. I feel like I'm old enough. I can look back and say, this is where I have been and whatnot. As you're walking through it, it just feels like sometimes you're just going through the weeds and trenches of things and whatnot. And you just don't feel like there's a light at the end of the tunnel. But it's a great field to be in. I mean, I highly, highly recommend the field of dentistry to anybody, and not just even like the clinical part of dentistry, but I think it's something that we're going to talk about later. A lot of the field of dentistry is more than just a single dentist with, a couple team members or whatnot that you're doing. Now it's becoming more of a business and a corporate. So there's a lot of aspect of dentistry that you can get into, even if it's not a clinical side of things. So that's exciting to me because I feel like we're really making the field of dentistry more than just people sitting there with teeth and coming in and saying, oh, I hate to be in a dental office. There's a lot more aspect to it. And of course, it's not just about teeth. I mean, I do a lot of aesthetic works, and then we have discussed that a little bit too. The field of dentistry is expanding more just than people coming in with a broken teeth and cavities that we're fixing, but it's about the overall health, and then kind of going beyond that and feeling good about yourself, and then also developing into more of the aesthetic side of things. So you're right, there's a lot to talk about.
Tell me what happened after dental school. Did you
So,
associate or did you open up a practice?
oh yeah, no. So when I was done with dental school, I did 2 years of residency program at Penn, oral medicine. That was a great experience, and I highly, highly recommend any educational path that you can take out of dental school. Because I think when you're in school, I mean, you're given 3 hours for a patient, and all you're thinking about is kind of getting that requirements signed off so you can get your requirements done, which is important too. But I think you're not able to really see the whole aspect of dentistry. One thing that I really talk about with my dentist that I talk to is that, I mean, I don't know, Eric, maybe you tell me, like, when you went to dental school, did you have a single course of business in dental school at all? I don't remember taking any dental school business school. I think there was a one, maybe something about like, this is life after dental school kind of thing. But you're coming out of it and now expected you not only be a clinician to give the best care, but now you have to be an HR, you have to run the practice, you got to know all the finances, you got to know like, how to negotiate for supplies and all that. I mean, all those things you never learn. And it's like either you get it or you don't. And some people are good at it and some people are not. So any experience that you can have after out of dental school, whether it's a mentorship or going into residency programs, I think that's really valuable. Clinically, I think it's a huge change from having that, one patient 3 hours to now being able to run. I always say to my doctors, when you're here seeing the real patient in the real office setting, I mean, these are real money paying people. So they want to get things done right in a good amount of time. So you no longer have 3 hours to do a crown prep or 2 hours to do a crown prep. You do need to get your skill better. And then these patients, obviously they should expect nothing less than the best. So that's one of the things that I see when I have new doctor coming into the office and I transition a patient over. But then like say the procedure that would take me, say like 15 minutes, is taking them an hour. And then patients now question, it's like, I don't want to be with this person. So you got to really hone your skills. So that's going to be important. So I do recommend residency. I do think any type of experience that you can have to better your skills, jump in and do it. I don't want to be stereotyping the new generations versus old generations, but I do think a lot of times you come out and think all of a sudden things are going to just fall in your lap and you're able to do things. It's a practice. I mean, it's called a practice for a reason because we're constantly practicing. And even for me now, after 20 some years, I still feel like there are things that I'm getting better at it because I'm doing more of it. It's literally what it comes down to is you do more, you're going to get better. So I think that's important. I did 2 years of residency program, but even prior to that in dental school, 3rd and 4th year, I worked in a, what I think at the time called infectious disease clinic. It was a government funded, the patients who are coming in, and it was running like a real clinic where there's an admin person and assistant who's helping you with that. And I honestly think that's where I got all my skills. It wasn't in the clinic floor of the dental school. So even if you're in dental school, I think it would be amazing if you, and not that you have enough time, obviously, because you're studying and all that stuff too, but if you could find a place where they will hire you as an assistant or hygiene assistant even, I think that's huge because you get to really see how the practice runs and how things running, learn the instruments and just knowing the backings of it. And then when you're working on the other side of it, and then when you're now the doctor hiring and working on them, now you know what it is like on the other side. And I think that's also huge. That empathy, being able to connect with your team, I think that's also a great skill to have. So, I mean, to me, that was a huge thing. And any experience that I had, anything that I saw during the residency program, that is what made me not to be able to not to phased by anything. So if I have a patient coming in that was kicked up by a horse and face is all cut up, I'm not going to panic. I've done this, and I helped with a head and neck trauma when I was in residency program. So any experience, I think it's going to be a great experience. And I think especially coming out of COVID and everything was quote unquote virtual and waved off, I do worry for some of these doctors coming out. They not by choice, obviously this is what happened, but a lot of times it's like they've only done 1 or 2 crowns and now you're like thrown into the real world and having to do the real thing. One other thing that I noticed that these young doctors need a lot of help in is diagnosis and treatment planning.